Welcome back to our Diabtron channel. Today, we're going to talk about a significant concern for individuals living with diabetes: eye edema. Diabetes can affect various parts of the body, including the eyes, and eye edema is a condition that deserves our attention. In this video, we'll discuss what eye edema is, its causes, symptoms, and most importantly, how to manage and prevent it. So, if you or someone you know is dealing with diabetes, this information is crucial. Let's get started. What is eye edema? Diabetic macular edema, DME, is a specific eye condition that occurs as a complication of diabetes, particularly in individuals with diabetic retinopathy. It affects the macula, a small area in the center of the retina responsible for sharp and detailed central vision. DME is characterized by the accumulation of fluid in the macula, which can lead to swelling, vision impairment, and potential vision loss if left untreated. The development of DME is closely linked to the damage that high blood sugar levels can cause to the tiny blood vessels, capillaries, in the retina. Over time, this damage results in weakened blood vessel walls and leakage of fluids and proteins into the macula. This swelling interferes with the macula's ability to function correctly, causing vision problems. Let's break down the pathophysiology of diabetic macular edema, DME, in simpler terms. High blood sugar. When you have diabetes, your blood sugar levels can get too high and stay that way. This high sugar damages the tiny blood vessels in your eyes. Leaky blood vessels. The blood vessels in your eyes can become weak because of the high sugar. They start to leak. Fluid buildup. The leaked stuff from your blood, like water and proteins, collects in a part of your eye called the macula. The macula is like the camera's lens in your eye, responsible for clear central vision. Swelling. All that extra fluid makes the macula swell. Think of it like a sponge that's soaked with water. It gets bigger and doesn't work as well. Vascular endothelial growth factor, VEGF. Because of the damage and swelling, your eye releases a substance called VEGF. This substance causes more blood vessels to grow, but they are not normal, healthy ones. They're leaky. Vision problems. With the macula swollen and leaky blood vessels, your vision starts to blur. It's like looking through a foggy or wavy window. You may struggle to read or see fine details. It affects your ability to see things clearly. So in simple terms, DME happens because of high blood sugar, which causes leaky blood vessels and a buildup of fluid in the eye's central part. This swelling and abnormal blood vessels lead to vision problems, like blurriness. It's essential to manage diabetes and get regular eye checkups to catch and treat DME early to protect your vision. The signs and symptoms of diabetic macular edema, DME, can vary in severity, and some individuals may experience no noticeable symptoms in the early stages. However, common signs and symptoms of DME may include blurred or distorted vision. Central vision becomes hazy, making it difficult to see objects clearly, especially fine details like letters when reading or recognizing faces. Wavy or warped vision. Straight lines may appear curved or wavy, which is often described as metamorphopsia. Reduced color. Perception. Colors may appear washed out or less vibrant. Dark spots or floaters. Dark spots, specks, or floaters may appear in your field of vision. Difficulty. Seeing in low light. Your ability to see in dim lighting or at night may be reduced. Increased blind spots. You may notice gaps or blind spots in your central vision. It's crucial to remember that DME primarily affects the central part of your vision. This means that while you may still have peripheral, side vision, your ability to read, drive, and perform tasks that require clear central vision can be significantly impaired. The diagnosis of diabetic macular edema, DME, typically involves a comprehensive eye examination performed by an eye specialist, such as an ophthalmologist or optometrist who is experienced in the management of diabetic eye diseases. Here's an overview of the diagnostic process for DME, medical history, and symptoms. Evaluation. The doctor will start by discussing your medical history, including your diabetes diagnosis and any diabetes-related eye issues. They will ask about any visual symptoms you may be experiencing, such as blurred or distorted vision. Visual acuity testing. Visual acuity is measured to assess the sharpness of your central vision. You may be asked to read letters from an eye chart. Dilated eye examination. To examine the inside of your eye, the doctor will administer eye drops to dilate, widen your pupils. This allows a better view of the retina, including the macula. Retinal imaging. Specialized retinal imaging techniques, such as fundus photography or optical coherence tomography, OCT, are commonly used to capture detailed images of the retina. OCT is particularly valuable for detecting and measuring macular edema. Fluorescein angiography, if necessary. In some cases, a fluorescein angiography may be performed. This involves injecting a special dye into a vein in your arm, which travels to the blood vessels in your eye. Photographs are then taken to detect any abnormalities or leakage in the retinal blood vessels. Assessment of macular thickness. OCT scans are especially useful for measuring macular thickness, which can indicate the presence and severity of macular edema. Diagnosis. Confirmation. Based on the results of these tests and examinations, the eye specialist will confirm the presence of DME and determine its severity. The treatment of diabetic macular edema, DME, aims to reduce or eliminate the macular edema, restore and maintain good vision, and prevent further vision loss. The choice of treatment depends on the severity of the condition and may involve one or more of the following approaches. Anti-VEGF injections, anti-VEGF, vascular endothelial growth factor. Medications are injected into the eye. These drugs reduce the amount of VEGF in the eye, which in turn decreases the leakage from abnormal blood vessels and reduces macular edema. Some common anti-VEGF drugs used for DME include ranibizumab, Lucentis, aflibercept, Eylea, bevacizumab, Avastin, although it's off-label for DME, corticosteroid injections. Steroid medications can be injected into the eye to reduce inflammation and macular edema. Dexamethasone implants like Ozurdex or fluocinolone acetonide implants like Iluvien are examples of corticosteroid treatments. Laser photocoagulation, focal laser therapy or photocoagulation is used in certain cases to treat DME. Laser treatment can help seal leaking blood vessels, which can reduce macular edema. However, it may not be as commonly used as anti-VEGF injections. Vitrectomy. In more severe cases of DME where other treatments haven't been successful, a surgical procedure called vitrectomy may be considered. During a vitrectomy, the vitreous humor, the gel-like substance in the eye, is removed, and the surgeon can address the macular edema and any abnormal blood vessels. Regular monitoring and lifestyle management. It's crucial to continue monitoring your blood sugar levels, blood pressure, and cholesterol levels to manage diabetes effectively. Lifestyle modifications, such as maintaining a healthy diet, staying physically active, and avoiding smoking, can also support overall eye health. Preventing diabetic macular edema, DME, primarily involves managing your diabetes effectively and taking steps to protect your eye health. Here are some key measures to help prevent DME. Control blood sugar levels. Keeping your blood glucose, sugar levels within the target range recommended by your healthcare provider is essential. This is one of the most important steps in preventing DME. Manage blood pressure. High blood pressure can worsen diabetic eye conditions. Regularly monitor your blood pressure, take prescribed medications if necessary, and work with your healthcare provider to maintain healthy blood pressure levels. Manage cholesterol. Elevated cholesterol levels can contribute to the development of DME. Manage your cholesterol through a healthy diet and, if needed, medications prescribed by your healthcare provider. Regular eye exams. Comprehensive eye exams should be a routine part of your diabetes management. Yearly eye exams allow your eye specialist to detect any early signs of DME and other diabetic eye conditions. Dilated eye examinations. Ensure that your eye exams include dilation, which involves using eye drops to widen your pupils. Dilation allows your eye specialist to examine the retina thoroughly. Blood sugar monitoring. Consistently monitor your blood sugar levels as recommended by your healthcare provider. Keep a log of your readings and follow your diabetes management plan. Maintain a healthy lifestyle. Adopt a balanced diet that is low in processed sugars and unhealthy fats. Regular physical activity can also help improve your overall health and support blood sugar control. Avoid smoking. Smoking is harmful to your blood vessels and can worsen diabetic eye conditions. If you smoke, consider quitting and seek support to help you quit successfully. Medication. Compliance. If you are prescribed medications to manage your diabetes, blood pressure, or cholesterol, take them as directed by your healthcare provider. Adhering to your medication regimen is vital for controlling these risk factors. Stay informed and educated. Regularly educate yourself about diabetes management and its potential complications, including DME. Awareness and knowledge can empower you to make informed decisions about your health. Preventing DME is closely linked to managing your diabetes well and addressing its associated risk factors. By maintaining good blood sugar control, managing blood pressure and cholesterol, attending regular eye exams, and leading a healthy lifestyle, you can reduce the risk of developing DME and other diabetic eye complications. Always consult with your healthcare provider for personalized guidance on diabetes management and prevention strategies. In conclusion, eye edema is a diabetes-related eye condition that can be managed and, in some cases, prevented with proper care. If you have diabetes, taking care of your overall health, managing your blood sugar, and regular eye checkups are crucial steps. Remember, early detection and treatment can make a significant difference in preserving your vision. Thank you for watching today's video. If you found this information helpful, please give us a thumbs up and subscribe to our channel for more health-related content. And as always, consult with your healthcare provider for personalized guidance on managing your diabetes and its related complications. We'll see you in the next video.